Prime Minister Bennett aims to vaccinate all of them with the booster by the end of the month. Demand has been high so far, according to the healthcare providers. But with more than 2,000 new cases per day and some decreased effectiveness around the vaccine, the country's health authorities are recommending the booster to protect the nation's most vulnerable communities. But earlier we got further insight on the situation from public health expert Dr. Manfred Green.
I think that we need to be very creative about the schools. There's no doubt that keeping children out of schools is awful. I mean, it's just not good for everyone. So I think that any possible solution should be looked at. Quarantining and keeping people out of school because of positive cases is a fairly extreme reaction, although under certain circumstances we need to do it. So I think that the use of testing now, widespread testing, is certainly a very good way of looking at it and of trying to solve that problem. And I think that can be done.
Now, what are your thoughts on the issue around vaccines in the schools? Now, we've already a list of them provided on a routine basis every year in Israeli public schools, but we've seen a bit of a conflict emerge over the desire from the health officials to have coronavirus vaccines potentially administered in schools. The education ministry pushing back on that. Is this would that help? Is there a reason not to incorporate coronavirus vaccines into the school regimen of vaccines?
I think that the concept of having health in the schools or some promotion of health in schools is excellent. And we've vaccinated in schools for many, many years. I mean, it's a tradition that's gone through way back. I think it's a very good idea. I would say that that would be a very good solution. Obviously, those who can be vaccinated outside and prefer to can do that, but the actual monitoring and implementation is much more efficient in the schools.